Alyssa started speech therapy at 18 months, and it was interesting because we had seen some other interventionists before working with Jen and Pita, and I think having Pita there as a facility dog absolutely helped us see results more quickly because rapport was established pretty much immediately. There was strong motivation to participate, and as a parent, it's really important that we get quality services as immediately as we can because we know that there's kind of this short window of development, especially when our children have delays. And so the fact that we could dive into our speech sessions and we didn't have to work through maybe some of those behaviors where she didn't want to participate or it was a transition to a new speech and language pathologist, we didn't have to kind of overcome those issues because Pita was really that bridge into making therapy successful. She saw him and wanted to be engaged, wanted to be there, and wanted to participate.
What is your favorite thing to do with Pita?
My favorite thing is to do with Pita is snuggle.
You love to snuggle
Play
her.
with her.
Well, a facility dog is, I don't have a disability, but I work at a facility where I serve people that do have disabilities. She is, especially at my school, I work at a Title I elementary school, so a lot of those children don't have a lot of positive things in their life, or some of their experiences with animals may not have been the best. They don't have the same opportunities of engaging with special events and things like that at school that some other kids may have. So having Pita there is such a treat for them. They love her so much. Every morning I get there early and all of the kids come up to her and they get to pet her. It just brightens their day. You see the smile on their face. When we walk out at lunchtime, they all literally chant, "Pita, Pita," and they are just so happy to see her. So my kids personally, it just makes the session fun. They're excited to come here, where speech isn't always exciting. It's something that's hard for them, or they may have anxiety about it. It's something they may be embarrassed of if they're a little bit more aware or older. So having Pita be there, that's a non-judgmental partner. She can just sit there and listen. She's not going to judge them. They're free to be themselves, and they can always depend on her and her love. As long as they pet her, she is their best friend. So it's wonderful.
I'm a recreation therapist, and with recreation therapy, we take a look at a patient's pre-morbid leisure interests and incorporate them into a physical rehab setting just to really improve in various impairments such as physical, cognitive, social, and emotional.
Say hi, everybody.
This is Willis.
In every aspect that a clinician cannot, Willis is there. Sometimes we have patients that don't want to get out of bed because they're in pain or they've had a long day, and when we tell them that Willis is coming, their attitude totally changes. They want to get out of bed. They want to work with Willis. To give an example, if we have someone that has a stroke, they may have paralysis on one of their sides, their right or their left side. So we really encourage them to use that side, that impaired side, to stroke Willis, to pet Willis, to massage Willis, to feed Willis. Willis loves it all and allows them to do that. He's trained in so many different tasks and skills that I can use those and incorporate them into therapy. But just the patience that the dogs have and the temperament that the dogs have, it's beyond compare. And there's so many things that we can do incorporating all the skills that he has. These dogs are special and they're like no other. Any person is privileged, any facility is privileged, any child is privileged to have one of these dogs because 100% it's going to change their lives.